if presidential candidate Mitt Romney has it wrong, did Governor Mitt Romney have it right? Do you think what's happening in Massachusetts is a good model to build upon?
No. I think that he was more ambitious about trying to affect the healthcare system then than he is now, but it was still basically an individual mandate, as you all know, and then a scramble to figure out ways in which you could try to influence the private insurance companies to come up with a plan that was affordable. Massachusetts, like many other states, is going through this debate right now. How do you insure everybody? How do you do it? And the answer is you have to regulate the private insurance companies dramatically. You have to change the rules of their business plan, and that's what the debate, I think, in Massachusetts is largely focused on. Because
Senator Edwards' plan and Senator Clinton's plan have the individual mandate. Is that going to be problematic down the road?
You know, it depends. Both of them say that they are going to come up with a public and private set of choices that are affordable to everybody. And so they're talking about subsidies for the very poor to get health care basically for free, and various ways to control the costs, the premiums that health insurance providers charge if they want to participate in what Hillary calls her federal employees benefit plan opened up to all Americans.
That's the plan that the Congress people now have.
We are going to have to be very, very involved in this debate to make sure that if there's an individual mandate, there's also lots of pressure to produce a decent health care plan at a decent price that everybody can reasonably afford.
If I haven't been clear about that, when there's an individual mandate, you, the individual, have an obligation to purchase health insurance. That is the law then.
Yeah, and it seems to me it's totally incumbent on the government to come up with a something that you can afford to buy, and a system of subsidies for people who can't afford health care on their own.
Now, the debate we're having on Capitol Hill right now is not about a universal health care plan. It's about the state children's health insurance program. A bill has passed the House and the Senate that would expand the program to cover an additional. There's about 9 million kids currently uninsured. This would cover about 4 million of them. But President Bush is on the verge, or if he hasn't already, vetoing it. What do you think is behind Bush's actions here?
Again, Bill, the real answer is a right-wing ideology. Bush knows that insuring kids is very, very popular. In fact, it's causing great pain to lots of his party members in the Congress who have gone along with him and opposed this thing. But his quotes about this thing are that if you give health care to kids, the rest of the country, adults and families, will want health care too. The other ideological stance that he's taken is that this steals potential customers away from the private insurance industry. It's pure and simple ideology. It's very, very unpopular. Senators like Charles Grassley and Orrin Hatch,
the Republicans,
who are Republican senators not known to be socialists, are strongly supporting this health care plan for children, and it is another example of why the modern-day Republican Party seems to be leading its members off of a cliff in terms of the upcoming 2008 elections.
You raise an interesting point about the socialized medicine, argument that keeps coming up. They're making it with the Children's Health Insurance Program, and they're saying it about the plans that Clinton and Edwards and Obama have released, even though they have private insurance as part of the mix still. What is the response that can be given to put to rest the notion that this is socialized medicine?
Well, I think we're going to have to handle that head on. The Republicans are losing support among their key voters, middle-class people who now don't see the Republican Party doing anything except undermining people's economic security. Social Security could be considered a socialist venture. So could Medicare. We're going to have to simply explain that there are some things too important to be left entirely to the market, and that the American people would rather have a health care system that works for everybody than leave whether or not you're sick or well or die waiting to be treated up to the private sector. So it's going to be a grand debate, and I think we can't be intimidated by these know-nothing conservatives whose only retort is that somehow what we're talking about is socialism. What we're talking about is using democracy to make sure that everybody has health care the way we use democracy to make sure that everybody had Social Security and Medicare.
And so looking ahead to 2008, is this going to be a central question between the candidates that we have to be ready to take head on, or is this going to be something that fades from the headlines while we talk about Iraq and terrorism more?
I think it's going to be a central issue. I think that yes, Iraq is dominating everybody's judgment of the candidates, but the American people also know that the healthcare system is in crisis, and that's not the only domestic crisis going on. The loss of good jobs here in America, goes hand in glove with the healthcare crisis. So I think that the American people want a real debate about healthcare, and we can expect that the Republican Party will not significantly change their tune. It's going to be the Democrats talking about the details of the healthcare system, with the Republicans talking about ideology and socialism. And if that's the contest, I think the people that want to change healthcare for the better have a good shot this time.
Excellent. Well, thank you so much for your time, Roger. Thank you for your insights.
Great to be with you, Bill.
My pleasure. This has been the Liberal Oasis radio show on WHMP, News, Information, and the Arts. If you missed any part of the broadcast, check out LiberalOasis.com for audio and video podcasts. And don't forget, drinking liberally at the Northampton Brewery every Tuesday at 6:30 p.m. This is Bill Scher on the Liberal Oasis radio show on WHMP, News, Information, and the Arts.